Not 120, not 130, not the number your doctor circled on a chart 10 years ago, and almost certainly not the number anyone explained to you in a way that actually made sense for your age, your body, and where you are in life right now. That's the number, 127. We're going to come back to exactly what that means and why it changes everything in just a moment. If you've been told your blood pressure is a little high, and you're not sure whether to worry, if you've been on medication for years but no one has ever revisited whether your target number still makes sense for someone your age, or if you've done everything right, the walks, the less salt, the stress management, and your reading is still sitting at 138 or 142 and you feel like you're failing, this video is for you. My name is Dr. James, and I specialize in cardiovascular health and preventive medicine for adults over 55. I've spent 10 years working with patients who are managing blood pressure not in their 30s, but in the decades that actually matter most, their 60s, 70s, and beyond. By the end of this video, you're going to know the single most important blood pressure target for adults over 65. Not the generic number printed on every pamphlet, but the evidence-based, age-adjusted target that some of the largest clinical trials in the last decade have confirmed. And I'm going to give you 4 habits to add and 3 to eliminate to actually get there. Stay with me. Before we get into the list, I want to tell you something. Every single strategy I'm going to share with you today costs less than $15 a month. Most of them cost nothing. And one of them, number 5, is going to completely reverse something you've almost certainly been told was helping you. Don't skip to the end. The order matters. Before I give you the list, I need to explain something that almost nobody talks about in a standard 15-minute appointment, even though it is the foundation of everything we're about to cover. I call it the stiffness shift. Here's what it means in plain language. When you're 35, your arteries, the tubes that carry blood away from your heart, are flexible, like a new garden hose. Every time your heart beats, those walls stretch and absorb the pressure. Your numbers stay stable. But as we age, those walls gradually become stiffer, less elastic, more like a rigid pipe than a flexible hose. This is not a disease. This is biology. And it means 2 things that are critically important. First, your systolic number. That's the top number in your reading. The one that reflects the pressure when your heart beats, naturally trends higher as you age. That is partly expected. Treating it the same way you'd treat high blood pressure in a 40-year-old is not the same science. Second, because your arteries are stiffer, they are also more sensitive to being overtreated. Driving your blood pressure too low, especially if you're on medication, can reduce blood flow to your brain, your kidneys, and your heart. This is called hypoperfusion. It means underdelivery of blood to organs that need it. The stiffness shift is why the target number after 65 is not what most people assume, and it's why every item on this list is measured against one question. Does this work with aging arteries, or does it fight against them? Keep that in your mind. It's the lens for everything that follows. Habit to add number 1. Aim for 127, not 120. The counterintuitive claim, trying to get your blood pressure to 120 over 80 after age 65, may not only be unnecessary, for some people, it may increase risk. The science. In 2015, the SPRINT trial, published in the New England Journal of Medicine, followed over 9,300 adults, many over 65, and compared outcomes at different blood pressure targets. The intensive target group aimed for under 120 systolic, and yes, they had fewer cardiovascular events. But, and this is the part that didn't make the headlines, they also had significantly higher rates of acute kidney injury, dangerous drops in blood pressure when standing, called orthostatic hypotension, meaning dizziness when you rise from a chair. And in some subgroups, the benefits disappeared or reversed in adults over 75, with certain health profiles. A 2021 follow-up analysis in JAMA Internal Medicine concluded that for older adults, particularly those with some degree of frailty or multiple medications, a target of 125 to 130 systolic is associated with the best overall outcomes, not 127. That's your real target. Not perfect, not aggressive, optimized. The practical action step. Ask your doctor specifically, what is my personalized blood pressure target given my age and current medications? Write it down. Put it on your refrigerator next to your grocery list. Not the generic 128's here's your number. The honest caveat. If you have diabetes, chronic kidney disease, or have had a prior stroke, your target may differ. This is a general framework, not a replacement for a conversation with your physician. Habit to add number 2, the 5-minute morning walk before breakfast. The counterintuitive claim: you don't need 30 minutes of exercise to meaningfully lower your blood pressure. In fact, timing your movement may matter more than duration. The science: a 2022 study in hypertension, the American Heart Association's own journal, found that short bouts of walking before eating in the morning were associated with measurably lower 24-hour ambulatory blood pressure readings compared to equivalent exercise done later in the day. The mechanism relates to cortisol, that's your morning stress hormone, and its interaction with vascular tone, meaning how tight or relaxed your blood vessel walls are at any given moment. The practical action step: before your first meal tomorrow morning, put on your shoes and walk outside for exactly 5 minutes, around the block, to the end of the driveway. It doesn't matter. Do not check your phone. Breathe through your nose if you can. Come back, that's it. Do it for 2 weeks before evaluating anything. The honest caveat: if you experience chest pain, shortness of breath, or significant dizziness during any physical activity, stop and speak with your doctor before continuing. Never push through cardiac symptoms. Habit to add number 3, potassium before you reach for less salt. The counterintuitive claim: almost nobody tells patients this, but increasing potassium may do more for your blood pressure than simply cutting sodium, and the research has said so for decades. The science: a landmark review in the British Medical Journal, 2013, analyzed 33 randomized controlled trials and found that increased potassium intake was associated with a mean reduction of 3.49 mm Hg systolic and 1.96 mm Hg diastolic, without any change to sodium. The mechanism: potassium helps your kidneys excrete excess sodium. It relaxes blood vessel walls. It counteracts the stiffness shift directly. The practical action step: add one of the following to your daily diet, just one, every day, starting this week. Half an avocado, approximately 487 milligrams potassium. 1 medium baked potato with skin, approximately 925 milligrams potassium. 1 cup of plain cooked lentils, approximately 730 milligrams potassium. The daily adequate intake for adults over 51 is 4,700 milligrams. Most people over 65 get barely half that. Closing that gap is low-cost, food-based medicine. The honest caveat: if you have chronic kidney disease or are on certain blood pressure medications like ACE inhibitors or potassium-sparing diuretics, high-potassium foods can be dangerous for you. Check with your doctor before significantly increasing intake. If this information is giving you something you wish you'd heard years ago, type the word "finally" in the comments below. I read every one, and if you haven't subscribed yet, hit that button now. Next week I'm releasing a video on the one nighttime habit that drops blood pressure by morning. Almost nobody connects these two things, and I don't want you to miss it. Habit to add number 4. Measure your blood pressure at the right time. The counterintuitive claim: the blood pressure reading your doctor sees in the office is almost certainly not your real blood pressure, and acting on it alone may be leading you to be overtreated or undertreated. The science: a condition called white coat hypertension, meaning your blood pressure rises in medical settings due to stress, affects an estimated 15–30% of patients, according to research published in the Journal of the American College of Cardiology, 2019. The opposite, masked hypertension, means normal readings in the office, but dangerous elevations at home. Both conditions are missed when we rely solely on in-clinic measurements. The same research confirms that home monitoring is one of the most powerful, zero-cost interventions for blood pressure management available. Not because it treats anything, but because accurate data leads to accurate decisions. The practical action step: take your blood pressure at home, twice a day, for 2 weeks. Here is the exact protocol used in clinical research. Sit quietly for 5 minutes first. No coffee in the 30 minutes prior. Take 2 readings, 1 minute apart, in the morning, before medication and before eating. Repeat in the evening. Record every number. Bring the log to your next appointment. A validated home monitor costs between $25 and $50. It is the most important medical device in your home. The honest caveat: home monitors must be validated and properly calibrated. Look for devices with an upper arm cuff, not wrist, and check that your model appears on the validated device list at validatebp.org. Habit to eliminate number 1. The low-sodium everything trap. The counterintuitive claim: obsessively chasing low-sodium labels at the grocery store may be creating a false sense of security. while the real driver of your blood pressure hides in plain sight. The science. Research published in The Lancet 2021, as part of the Global Burden of Disease study, found that while sodium does matter, its effect on blood pressure is highly individual, and for a significant subset of the population, sodium sensitivity is actually low. What matters far more for most adults over 65 is the ratio of sodium to potassium, not absolute sodium intake alone. Chasing low-sodium versions of processed foods often means you're still eating ultra-processed products that are high in refined carbohydrates, inflammatory seed oils, and food additives, all of which have independent effects on vascular health. The practical action step, the 5-second rule. At the store, flip any packaged food over. If there are more than 5 ingredients and you cannot identify them all as real food, put it back. Not because of the sodium, because of everything else. The honest caveat. Sodium does matter, especially if you are sodium sensitive, more common in Black adults and adults with kidney disease. This is not a license to ignore sodium. It's an argument for not treating it as the only number that matters. A bit to eliminate number 2, taking your blood pressure medication incorrectly. The counterintuitive claim. The time of day you take certain blood pressure medications may matter as much as which medication you take, and almost no one is told this at the pharmacy. The science. The Hygia chronotherapy trial, published in the European Heart Journal 2020, followed over 19,000 patients for a median of 6 years. Patients who took at least one blood pressure medication at bedtime rather than in the morning had a 45% lower risk of cardiovascular death, heart attack, and stroke. The mechanism: nighttime dosing improves blood pressure control during sleep, when blood pressure should naturally dip, a pattern called nocturnal dipping that protects the heart and kidneys. The practical action step. Ask your doctor or pharmacist a single question. Would taking any of my blood pressure medications at bedtime be appropriate for me? That's it, one question. It costs nothing. Write it on a notepad and bring it to your next visit. The honest caveat. This does not apply to all medications equally. Some blood pressure drugs are specifically designed for morning use. Never change your medication timing without speaking to your prescribing physician first. Habit to eliminate number 3. Trusting that your last reading was accurate. The counterintuitive claim, a single blood pressure reading, even one taken properly, tells you almost nothing meaningful. Acting on a single number is one of the most common mistakes in blood pressure management, and the system has set you up to do exactly that. The science. Blood pressure is extraordinarily variable, affected by posture, conversation, bladder fullness, recent food intake, temperature, and emotional state. A 2020 analysis in hypertension found intra-individual variability of up to 20-30 mm Hg across readings taken the same day. Diagnosing or adjusting treatment based on 1 or 2 readings, which is standard in a 10-minute appointment, introduces significant error. This is not your fault. You deserve a system that captures your real average, not your most anxious Tuesday morning. And here is where I need to be direct with you. You acted in good faith. You went to your appointments. You sat in that cuffed chair. You watched the nurse write down a number and hand it to a doctor who had on average about 4 minutes to think about it. The system was not designed to capture blood pressure the way blood pressure actually behaves. The external villain here is not your doctor. It is a healthcare model built around speed and throughput, 15-minute appointments, paper checklists, and blood pressure targets, designed for population statistics, not individual human beings over 65 who are managing real life. The practical action step. Return to habit #4. The 2-week home monitoring protocol is your counter to this. Real data beats a single anxious office reading every single time. The honest caveat. Some people experience elevated readings at home due to anxiety about monitoring itself, a home version of white coat syndrome. If your readings vary by more than 15 points between sessions, mention this pattern to your doctor. Margaret, 68, retired school librarian, Cincinnati, Ohio. Margaret came to me with a blood pressure that averaged 158/90 over her most recent set of office visits. She was already on one medication, walking 3 times a week, and had cut salt so aggressively that her family had started calling her cooking hospital food. She felt like she was failing. The habit she changed. We added a structured 2-week home monitoring log and discovered her real average was 144/88, still elevated but significantly lower than her office readings. We also added a daily half avocado and shifted her medication to bedtime. 6 weeks later, 131/80. Margaret told me I thought I was just bad at this. Finding out the office number wasn't even my real number. I cried a little honestly. Relief, not sadness. Robert, 71. Semi-retired contractor. Tucson, Arizona. Robert had been told his blood pressure was controlled at 148/86 on 2 medications. He wasn't having symptoms. He assumed controlled meant fine. But he'd never had a home monitoring conversation, and his nighttime blood pressure, we found out through a 24-hour ambulatory monitor, was barely dipping at all during sleep. His kidneys were under pressure every night. The habit he changed. With his cardiologist's approval, one of his medications was moved to bedtime. He also added a 5-minute morning walk before breakfast, which he admitted he'd been meaning to do for 4 years. 3 months later, 128/79. Robert said, I spent 2 years thinking 148 was the finish line. Turns out the game wasn't even being played on the right field. I want to take a moment here because I know some of you are feeling something right now that isn't entirely comfortable. Maybe it's frustration. That some of this information, the timing of medication, the potassium gap, the office reading problem, has existed in peer-reviewed literature for years, and no one sat down with you for 15 minutes to explain it. That frustration is valid. You deserve better than a number on a cuff and a prescription renewal with no conversation attached. But here is the relief, and I mean this. You are not behind. You are not broken. The stiffness shift is biology, not failure. The system gaps are real, but they are also bridgeable by you, with information starting today. Almost certainly there is at least one thing in this video you can act on before tomorrow. Probably more than one. And you now know something that almost nobody leaving a standard appointment knows. 127 is the target. Home monitoring is the method. Potassium may matter more than salt restriction alone. And the time you take your medication might be the one variable that nobody has ever asked you about. Do not wait until tomorrow. Within the next hour, I want you to do one physical thing. Get a piece of paper, actual paper, not your phone, and write down these 3 questions. 1. What is my personalized blood pressure target given my age? 2. Would taking any of my medications at bedtime be appropriate for me? 3. Can we review my home monitoring readings together? Fold that paper, put it in your wallet, your purse, or tape it to your bathroom mirror. Bring it to your next appointment and read every question out loud. That piece of paper is not a WebMD printout. It is not anxiety. It is a patient asking evidence-based questions that any good physician will welcome, and that any good physician will take the time to answer. You've been managing this condition in good faith for years. You deserve a management plan built on your real numbers, your real biology, and the real science of what healthy blood pressure means after 65, 127. Now you know what it means, and now you know how to get there.